My name is Dr. Daniel Doyle, and if you're watching this video today, you or someone you know is currently suffering from migraines. Now, you're probably trying various forms of therapy and treatment, and you're not getting the results that you want. Most importantly, you're not getting the answers that you deserve. So today, I wanted to talk to you about a very common cause of migraines that usually goes undetected. And that cause of migraines is due to losing the curvature in our neck. Now, why would that cause these different symptoms that accompany migraines, such as vision problems? And the reason behind that is because when we lose the curvature of our neck, we actually traction our spinal cord. And what happens is when we traction or damage our spinal cord, it causes decreased blood flow to that area, and most importantly, our brain. If we look at our brainstem and where the nerves go, and which organs they go to, a decrease of blood flow to that area causing dysfunction can absolutely explain why we're having those symptoms. Most of the time the patients, they ask me, "Doc, how do I lose the curvature of my neck?" And really the answer is from any prior injuries that we sustained. It can be at the very beginning of our life, at the birthing process. Or it most likely is due to motor vehicle accidents that we kind of thought were, petty, but actually cause significant damage to our spine. So how do we determine if the lack of curvature in our spine is causing the symptoms that we are having? Well, what we would have to do is we would have to have you come in for a free consultation. There, we'll go over your history. I'll determine if you're a chiropractic candidate. If you are a chiropractic candidate, then we'll do a very extensive examination. We'll test for joint mobility and see how our joints are moving to determine any nerve interference. It will also include X-ray analysis where we will see how our spine is positioned. Now that is extremely important in determining whether or not our spinal cord is being tractioned, damaged, or twisted. After that, after we go over your results and we see that yes, that is indeed the case, then we will go on and do specific treatment that includes very specific adjustments as well as exercises that we'll do at home. Now, most of the patients that I see that are migraines, unfortunately, they feel that they're at their last resort. They feel like, we've done everything and there's nothing that we can do to help. And that's very sad because when we find out that the lack of curvature in their spine is causing their symptoms and that it could have been treated conservatively, specifically through chiropractic, we know that they wasted a lot of time and money. So, for example, I am currently seeing a young mother in her 20s that has been experiencing migraines for, well, any sort of migraines is too long, but for her it's been over, about 3 to 5 years. These migraines are actually causing her so much pain that she's no longer able to care for her kids. She is forced to go into the other room, shut off the light, put a pillow over her head because she cannot stand any sort of light, and she most certainly can't stand any sort of sound. It's making her feel like a bad mother, and it's causing her to be depressed. She came, we sat down, we talked, we thought that she was a chiropractic candidate. We took specific x-rays, and if you want to come up here, and we saw that instead of having a forward curvature in her neck, we had absolutely 100% loss of her spinal curvature, and it's actually buckling backwards. This is causing severe traction of her spinal cord and decreased blood flow to her brain. Also, if we want to take a quicker look over here, this lack of curvature has consequences beyond just tractioning our spinal cord. It's actually causing our spine to be misaligned when we look at it from the front. This should be nice and straight up and down here. And what we're seeing here is that it's deviating to the left, causing extra twisting of that spinal cord, causing further damage. So after we went through her examination results, we talked to her about the various forms of treatment. We let her know that there was hope. And within 2 weeks, we started seeing significant improvement. Now she's able to have the life that she deserves. She's able to care for her kids. She's no longer depressed. And really, she got her life back. All because she had a lack of curvature in her neck. And what we found out that through her history is because she had a motor vehicle accident about 5 years ago that she thought was, wasn't significant. So, if you are experiencing these problems, if you are having migraines, you think you're at your last resort, or if you're just experiencing them in general, give us a call. Let's see if we can help you. I will gladly sit down, do a free consultation. If you are a chiropractic candidate, we'll get you the answers that you deserve.